If you want more income, well, how do you do that with your practice? There's a couple things, 3 things specifically that we focus on to help clients do that. Number 1, you have to introduce efficiencies. What does that mean? It means making your practice more efficient. There's a lot of ways to do that. When you get to be very high volume practice, you have to do this, because if you're not efficient, you can't do the numbers that I did one time. We were doing 750 visits a week in one practice. That was a lot of patients. So we learned ways to make it more efficient. We found that if we get our staff trained on how to do things like greet a new patient or help them fill out their paperwork, we can do it in a very seamless way if we practice it first, which means role playing. Oh my gosh, people hate role playing. We can't do that in my practice. If you want to get efficient, you will. And let me tell you something about role playing. Most Fortune 500 companies role play to some degree on what they do. If you're dealing with the public, you should role play. I know attorneys can go to mock courtrooms and role play their case. If they're going to actually go to trial, they go to trial. They're going to go and role play the case before, because they don't want to practice. They role play presenting their case before they get there. And they'll hire a mock courtroom with a mock judge and a mock jury, and they'll present the case in a way that they feel comfortable with. So it's not awkward when they're doing it the first time. You should do the same thing. And to be more efficient, you could role play how to walk somebody back to a room, or how to help them fill out their paperwork, or whatever else it is that you need to role play. We help you figure these things out, and we help our clients do this so they can become more efficient and more seamless. That's the first one. The second one would be to increase patient control. If you want to get an increase in your income, you have to increase patient control. So let's talk about that, because control scares a lot of people. Oh, I don't want to control people. I'm not a control freak. I was controlled and it was bad. We're not talking about bad control. What we're talking about is good control. Control is only bad when you don't have it. If I was driving down the street and you were sitting next to me and I was in control of the car and you tried to reach over and grab that wheel and help me control it, that would be a disaster. That's bad control. But if I was in good control of the car, you don't have to do that, that's good control. If I were to have a heart attack and pass out while I was driving, you better jump over and start controlling that car, or we're all going to be in trouble. So that's what I'm talking about with control. When a patient comes in with a health problem, part of their health, part of the way they take care of their body is out of control. They need somebody to take control. They are actually looking for a doctor who will control them and put them back in control. And it's funny, they'll come in and have all their defenses up because they don't want to let you control them, because they think you're going to do bad control, until they start to realize you're going to do good control. If you run patient control, that could be something like tell them that they need to have their appointment at a certain time, or you don't want them to wait a week, you want them to do a certain frequency, like a care plan. Oh my gosh, I don't do care plans, I hate care plans. You know what? The body works the way the body works. And I know there's a frequency involved in what we do that actually makes it effective. And if you don't convey that to your patients and don't insist they follow that frequency, it's not going to work for them, and then they're going to blame you, and they should. So what you should do is you should be able to be willing to take control of an out of control patient. Anybody that has a health problem is partly out of control. So that's the second thing we do to help increase your income. The third thing we do helps to feed the first two, and that is employee culture. So you have to create a culture where your employees are on board. They want to help your patients too. They take a vested interest in it, and they're 110% there all the time. You don't want somebody showing up, oh, it's Monday, so I'm only going to give 60% because it's Monday. It's hump day, Wednesday, I'm not really working hard, I'm waiting to get through the end of the week. It's Friday, we all start quitting at noon because it's Friday, thank God it's Friday. You don't want that atmosphere in your office. Your patients need help. They don't want somebody in there with their attention on something else while they're helping them. Just think about it. Would you go get surgery from a guy who just got served with divorce papers 5 minutes before he walked into the surgery? I don't think I'd want to be in that position. I'd want somebody who's focused on what they're doing. One of the things I used to do in my practice when I was adjusting is I would tell my employees, if you need to talk to me, unless the place is on fire or somebody's got a gun, do not interrupt me while I got my hands on a patient. And there was never a fire and there was never a gun. Nobody ever interrupted me. What would happen is my employees would come up and they'd stand there while I was in position doing an adjustment, and sometimes the patient would go, do you need to talk to them? And I'm like, no, I'm working with you right now. And I would finish what I was doing, and then I would turn to the employee and say, what's up? My patients appreciated that so much because they knew I was 100% focused on them. You can't do this by yourself. You need buy-in from your staff. You need to create a culture where it's okay to be enjoying the work that they're doing and 100% focus on helping patients get better. You need to do those three things. If you want to increase your income, you need to be more effective and more efficient. You need to be controlling the patient because they're out of control and controlling them in a good way. And then you need to have an employee culture that helps your employees do the same things with the patients that you're trying to do. If you do those three things, I guarantee you, you will go up, your growth will grow up, your income will increase, and the ability to help more people will increase, and you will. And it will be more efficient for you, so it's not putting it all on your shoulders. You'll have help doing it. That's the only way you can grow a business to a higher level. So remember that, efficiency, control, and culture. Those three things together will help you grow. It's the only way you can go to the next level. And if you're interested in more content, if you like what you're hearing, you can subscribe and leave a comment.